Rajiv Gowda. Take 7 minutes, 7 minutes your time.
Thank you, sir.
Yeah.
Sir, this is a bill that I'm very broadly in support of, and it's a bill that was originally introduced by the Health Minister Ghulam Nabi Azad during the UPA time. And it's a measure of our bipartisan, multi-partisan consensus on the issue of AIDS and HIV and the amount of work that we need to do to cure this disease, that this bill is now coming forward from the NDA government and has broad support in the House. So when you actually look at the success stories in our attack on HIV and AIDS, we've got a good story to tell. India has actually seen AIDS-related deaths declining by 54% since 2007. And since we scaled up the provision of free antiretroviral therapy since 2004, we've cumulatively saved 4.5 lakh lives. This is a matter of great happiness that we've been able to achieve so much as a nation in addressing this scourge.
But we are the third largest in number, he said.
That's right, sir. But we have been making significant progress. So that's a matter of happiness. There's a long way to go. This bill addresses another aspect of this problem, sir. For example, it says it seeks to prevent stigma and discrimination against people living with HIV. These amendments will allow families that have faced discrimination to go to court against institutions or persons being unfair. This applies to the public sector, applies to the private sector. It's a very good move. So, but let's pay attention to that term stigma. More than the virus itself, stigma is the disease in this country. If you look at the negative stories that have emerged in the context of people with HIV and with AIDS, many of whom were infected inadvertently, were not even people who were involved in high-risk activities, you find that you had horror stories of people being stoned to death, children being separated, not being allowed to go to school, not being given food, things like that. You had people whose bodies were not given proper funerary rites, so all kinds of stigma was attached to this particular problem, to this particular disease. And that has not fully gone away. It's very good that we are providing legal and statutory sanction to measures that will allow patients, to allow people discriminated against to go out there and fight in court or with the ombudsman. So, but this stigma has another aspect to it. Many people are afraid to stand up and acknowledge that they are suffering from these kinds of illnesses, that they are afraid of revealing their situation, because then subtly and indirectly under the radar you will see all kinds of discrimination that they will not be able to take action against. There's another problem, sir. One of the major at-risk groups here is men who have sex with men. So this is an example of a kind of activity which is outlawed under Section 377 of the Indian Penal Code. That was originally overturned with that Nas judgment of the Delhi High Court, but the Supreme Court has said it is up to us in Parliament to actually enact laws that throw out this archaic section of the IPC. Until you throw out that archaic section 377, many people will be ready to take action to seek redress under the provisions of this law. So I would urge the government, you're doing a lot of progressive things here with this particular bill, but what use will it be if people are afraid to stand up and take action to seek redress because they will be prosecuted under some other provision which should not even be on the books in this era. So let me continue on that point. There is this issue of a stigma is something that we really need to address and bring in other legislation to remedy and clean up the context where we have these measures going forward. So, over the course of the UPA era, we came up with a lot of legislation that focused on rights, empowering people with rights. And this law also is a rights-based legislation. And when you say that people have a right to treatment, that right has to be backed up fully. And across party lines, the health minister today has seen all of us stand up, and some of us have moved amendments. People from other parties have moved amendments. I learned that my colleague Hussain Dalwai and I have both separately moved amendments, all focused on this phrase, as far as possible. So this across party lines, you're seeing that this phrase has to go. It does not fulfill that promise. It does not make that right actionable. And therefore, we urge you to remove this right, to remove this clause of as far as possible. And let me point out, sir, that there is a Supreme Court judgment which also says the same thing, that, that basically this is a ruling in December 2010, which says that the central government cannot deny its obligation towards people living with HIV by stating that receiving second-line ART treatment was, they cannot deny it. How and why? The Supreme Court essentially said that this falls under Article 21 of the Constitution, which is right to life. And therefore, given that kind of constitutional support for this right that is being enacted here, let us remove these 4 words which, which cripple that right. And that is something that I urge the Health Minister to do. So I will actually finish a little faster because I only want to dwell on just one more point, the issue of ombudsman. Multiple colleagues have raised the issue of ombudsman. So at this moment, it's one ombudsman per state. That's the impression I get. But states have, are huge, they have wide varying populations, and if people who are suffering from illnesses need to go and seek a redress, can they go thousands of miles, hundreds of kilometers, when they need redressal closer to them? So we should ensure that in the rules you add provisions which say one ombudsman per so many population, one ombudsman within a certain distance from, from centers of population, something like that, which ensure that people have equitable access to ombudsman. In any case, I want to support this bill. I urge the minister to remove those 4 words as far as possible from I think, section 14(1) of this bill. And when we do that, when this whole House unanimously passes that amended bill, I would think that we would be demonstrating our commitment to the vulnerable populations of India who are suffering from HIV, and we're demonstrating our commitment to equality for people of different sexual orientations, and this is something that is a progressive measure that we must support and make many more moves in terms of related legislation on 377, on transgender rights. There are numerous such legislation that we need to work on, so I commend this bill, sir, and support it. Thank you.
Thank you, Mr. Rajiv Gowdaji. Thank you very much.